right. Which of the following is a potential complication associated with his most likely diagnosis? Okay. 60-year-old man with history of working in construction industry presents with shortness of breath, persistent cough, 40-pack year, smoking history, chest X-ray reveals bilateral plaques and diffuse interstitial fibrosis. Um, hmm, Interesting. So with construction, you could be thinking asbestos, which would be like mesothelioma. Could also be thinking silicosis. Um, but that says silicotuberculosis, which is like, I guess, a combination of um, like the pneumococces of like a silica, I guess, tuberculosis thrown in there. Um, and he has the plaques and he has diffuse interstitial fibrosis. My gut was mesothelioma.
Okay.
Um, I'm trying to see why that wouldn't be it. Bronchogenic, Kaplan. I feel like I had a question on that the other day. I can't remember what it is. Um, Progressive massive fibrosis. It's like a more of a description. I'm not really sure what that is. Um, and then like if they just said like a pneumonocosis of silica, I'd put that in strong consideration. But I think I'd go with mesothelioma.
Yeah, so this is what I like here. So I want to make it a little bit more compact and simple in your train of thought here,
Okay.
right? So you got a older gentleman that was in the construction industry, so you got to be thinking risk factors for construction, right? Main construction, right? You can be exposed to asbestos for roofing. You're going
Yeah.
to be exposed to other roofing kind of equipment, right? And then he's
Hmm.
having shortness of breath and persistent cough. He also has a 40-pack year history, so that kind of muddles the picture a little bit because if you're smoking, you're really thinking of small cell lung cancer or squamous cell cancer of the
Hmm.
lung, right? But the
Hmm.
chest section reveals pleural plaques, which means plaque within the pleura of the lung, which is the periphery, right? And then you have fibrosis, which could be, that could also be caused by a lot of things too. So the pleural plaques are, highly, highly suspicious, right? Because that's, usually leads to mesothelioma mainly, right? So we can
Hmm.
talk a little bit here, right? So bronchogenic carcinoma is potential with smoking, but not, with
With
asbestos,
smoking, I
right?
usually think of the two S's, squamous or small cell.
Yep,
To me,
usually squamous or epic, but it can increase risk for bronchogenic.
okay.
Kaplan syndrome, right, is rheumatoid arthritis with
I couldn't remember what that
pneumococcosis.
was. Okay.
So coal
Okay.
miners is usually coal
Okay.
miners one. Okay, not associated with asbestos. Progressive massive fibrosis is pneumococcosis, such as coal workers or silicosis, but not asbestos, especially in
Okay.
construction workers. And then also silicosis, right? And usually kind of history of working in this is more asbestos. So just the risk
Okay.
factor of construction is higher for asbestos and then the pleural plaque. So
Okay.
mesothelioma is going to be your best here.
Okay.